14 signs that appear. 1 month before stroke. Understand the Pope Francis case. Have you ever wondered if your body would be trying to warn you about something serious? What if there were clear signals that your brain sends before a stroke? What would it be like to recognize a mortal danger weeks in advance? A stroke happens every 5 minutes in Brazil, leading many people to death or leaving devastating sequelae. The good news is that your body is an alert machine, sending signals up to a month before tragedy strikes. The recent case of Pope Francis, who had subtle symptoms weeks before he had to cancel appointments, demonstrates how these signs can appear in anyone. Would you recognize these signs if they appeared today in you or someone you love? Neurology experts confirm, identifying these early warnings can be the difference between life and death. Let's get started. 1. Silent alarm. Headaches that can save your life. Headaches that precede a stroke are not common. They usually appear intensely and persistently, unlike any migraine you've experienced before. Often, these pains resist conventional painkillers, continuing for days at a time. The location is also peculiar, often affecting only one side of the head. According to the Brazilian Society of Neurology, about 65% of people who suffered stroke reported atypical headaches. These pains are caused by the narrowing of the brain's blood vessels, a clear sign that something is wrong. The unusual pressure on the cerebral arteries causes the pain to be more severe upon waking or during physical activity. Pope Francis's case began just like that, with persistent headaches that were initially attributed to stress. More than 50% of people ignore this symptom, mistakenly associating it only with the stress of everyday life. Have you ever felt like you have a constant weight or pressure on a specific part of your head that just won't go away? 2. When the world turns, the imbalance that announces danger. Sudden dizziness and imbalance should not be ignored, especially when they occur for no apparent reason. You may feel as if the ground is moving under your feet or as if you are in a boat. This symptom happens because the brain is already suffering from small interruptions in blood flow. The areas responsible for balance, especially the cerebellum, are extremely sensitive to any circulatory changes. A Harvard University study showed that 72% of patients experienced episodes of imbalance. When blood doesn't get properly to certain brain regions, you literally lose control over your position in space. Many people describe the sensation as being drunk without having consumed alcohol. In the case of Pope Francis, aides noted that he needed additional support in some public appearances. The key here is the recurrence and lack of explanation for these episodes of imbalance. If your body is reeling for no apparent reason, this could be your brain begging for urgent medical attention. 3. Windows of the soul in danger. Visual changes that no one should ignore. Sudden vision problems are one of the most alarming signs that precede a stroke. You may experience blurry, double vision, or even loss of vision in one eye for a few minutes. These visual changes usually happen without pain, which causes many people to attribute them to eye strain. About 40% of stroke sufferers reported episodes of visual disturbances in the previous month. Temporary interruption of blood flow to the optic nerve or brain areas causes these symptoms. Visual changes before a stroke are like temporary electrical blackouts, warning you that power may go out permanently. A peculiar feature is that these changes often affect only half of the visual field. Pope Francis reportedly mentioned brief episodes of blurry vision, initially attributed to tiredness. Visual changes that last a few minutes and then disappear are called transient ischemic attacks. These mini-strokes are like dress rehearsals for a larger event and should never be ignored. 4. Lost words, the terrifying sign that your brain is in danger. Difficulty speaking or understanding speech is one of the scariest signs of an impending stroke. You may suddenly find yourself unable to correctly pronounce simple words or form coherent sentences. This symptom, called aphasia, occurs when the areas of the brain responsible for language begin to suffer. About 55% of stroke sufferers reported episodes of speech difficulty in the previous weeks. The sensation was described by patients as having the words on the tip of your tongue, but not being able to pronounce them. When your brain doesn't get enough blood, your ability to communicate can literally evaporate in seconds. A particularly alarming sign is when you use the wrong words without realizing it, such as calling a pen a clock. In the case of Pope Francis, observers have noted moments of unusual hesitation in his speeches. If you find yourself repeating the same word over and over again, or forgetting common object names, consider it a red flag. Speech difficulty may appear and disappear, lasting minutes or hours, before a complete stroke. 5. The talking face. Facial numbness as a crucial alert. Numbness or weakness on one side of the face is one of the most classic signs that precede a stroke. You may experience tingling, a feeling of numbness, or even not being able to control your facial muscles. This symptom occurs because the nerves that control your face begin to be affected by the lack of oxygenation. A simple test is to smile in front of the mirror. If one side of the face doesn't move like the other, that's worrisome. Studies show that 63% of patients had some degree of facial numbness before stroke. Your face is like a brain control panel. When half of it stops working, it's a cry for help. Facial tingling usually starts around the lips or on the cheek and can spread to the rest of the affected side. Observers close to Pope Francis have noticed a subtle asymmetry in his smile in some appearances. This symptom can be transient, lasting only a few minutes, which causes many people to ignore it. If you notice that you're dropping food on one side of your mouth when eating, this could be a sign of facial numbness. 6. Invisible half. When your body suddenly loses strength. Sudden loss of strength in an arm, leg, or an entire side of the body is a classic sign of impending stroke. You may drop objects for no reason, feel weak when trying to lift things, or lightly drag a foot when walking. Like facial numbness, this weakness strictly respects the midline of the body, affecting only one side. This characteristic happens because each side of the brain controls the opposite side of the body. Studies indicate that 77% of people have experienced episodes of unilateral weakness before stroke. When half of your body suddenly loses strength, it's as if half of your brain is screaming for help. A simple test is to extend both arms in front of you, with your palms up, and close your eyes. Aides close to Pope Francis have noticed moments when he seemed to have difficulty using an arm. This symptom can be intermittent, appearing and disappearing, which causes many people to attribute it to tiredness. The weakness can be so subtle that you only notice it when performing precision tasks such as buttoning a shirt or typing. 7. Stolen energy. The fatigue that hides a deadly danger. The extreme fatigue that precedes a stroke is not the common tiredness of everyday life. You may feel overwhelming exhaustion that doesn't get better with rest, as if you're running out of depleted batteries. This fatigue appears suddenly and unrelated to your recent physical or mental activities. Studies show that 80% of survivors reported unexplained and persistent fatigue in the previous weeks. The brain, when receiving less oxygen due to pre-stroke circulatory problems, goes into energy-saving mode. This exhaustion is like your body's emergency system, shutting down non-essential functions to protect the brain. Many people describe this sensation as, "It feels like I'm walking on sand," or "like gravity is stronger." In the case of Pope Francis, observers have noted a reduction in his usual energy and need for more rest periods. This symptom is easily confused with depression, stress, or thyroid problems, leading to misdiagnoses. If you feel constantly exhausted even after a full night's sleep, this deserves medical attention. 8. Mind in chaos. When your personality changes without explanation, sudden changes in behavior or mental confusion can precede a stroke by weeks. You may experience difficulty making simple decisions or feel inexplicably disoriented. Family members often notice changes in behavior before the patient does, describing them as not looking the same person. Studies show that 45% of patients had personality changes or mental confusion before the stroke. These changes happen because areas of the brain responsible for behavior and cognition are already suffering from reduced flow. When your brain is being deprived of oxygen, your essence, what makes you you, can begin to deteriorate. A worrying sign is when you become inexplicably irritable, apathetic, or emotionally unstable for no apparent reason. People close to Pope Francis have noted that he occasionally seemed momentarily confused during some meetings. These cognitive symptoms can fluctuate, with moments of complete lucidity interspersed with periods of confusion. Spatial disorientation is particularly alarming. If you suddenly don't recognize your way home, seek help immediately. 9. Silent pressure, the invisible killer in your arteries. High blood pressure is both a risk factor and a warning sign for impending stroke. You can have pressure spikes without feeling anything at all, which makes this sign particularly insidious. In the weeks preceding a stroke, blood pressure often rises to dangerous levels persistently. Studies show that 92% of patients had uncontrolled hypertension in the previous month. The increase in pressure occurs as a vicious cycle. The vessels already compromised cause the heart to increase the pressure. Your blood pressure is like a thermometer that measures the storm forming in your blood vessels. An alarming sign is when the pressure remains elevated even after periods of rest or with the use of usual medication. In the case of Pope Francis, sources close to him mentioned that his doctors were monitoring for elevations in blood pressure. Even people who have always had normal blood pressure can develop sudden hypertension as a sign of impending stroke. Regularly monitor your pressure. Readings above 160 per 100 millimeters of mercury are particularly concerning. 10. The noise of danger. Tinnitus that few relate to stroke. The ringing in the ear that precedes a stroke has specific and worrying characteristics. You may hear a pulsating sound, synchronized with your heartbeat, different from the constant tinnitus associated with hearing problems. This symptom occurs because the turbulent flow of blood in the already partially clogged arteries creates audible vibrations. About 32% of patients have reported pulsatile tinnitus in the previous weeks. The sound is often described as whooshing, or as if it is listening to the ocean inside your head. This buzzing is literally the sound of your blood struggling to pass through narrowed arteries on its way to your brain. A particularly alarming sign is when tinnitus is accompanied by a feeling of pressure inside the ear or head. Sources close to the matter revealed that Pope Francis occasionally mentioned unusual auditory sensations. This symptom can be easily confused with otological problems, leading to ineffective treatments and delay in correct diagnosis. If you hear your own heartbeat in your ear, especially in just one of them, this deserves urgent neurological attention. 11. Stomach upset. Nausea that your brain produces as an alert. Nausea and vomiting with no apparent cause can be neurological signs of impending stroke. You may feel waves of nausea without having ingested anything that justifies it, or vomit even on an empty stomach. This symptom happens because areas of the brainstem responsible for controlling nausea can be affected. Studies indicate that 38% of patients experienced unexplained nausea in the previous weeks. What differentiates these nauseas from common digestive problems is that stomach medications usually do not bring relief. When your brain doesn't get enough oxygen, it can set off the alarm through your stomach. A particularly worrying sign is when nausea comes on suddenly and is accompanied by cold sweating or pallor. In the case of Pope Francis, sources close to him mentioned episodes of gastric indisposition that did not respond to treatments. This symptom is particularly common in strokes that affect the posterior region of the brain, including the cerebellum. If you have recurrent motion sickness unrelated to eating, movement, or infections, consider a neurological evaluation. 12. Swallowing fear, when eating becomes an alarming challenge. The difficulty swallowing that precedes a stroke is not just a discomfort in the throat. You may choke frequently when ingesting liquids, feel that food stops halfway through, or notice saliva buildup. This symptom occurs because the nerves that control the swallowing muscles begin to be affected. Studies show that 28% of patients had some degree of dysphagia in the weeks prior to the event. What makes this sign particularly dangerous is that it significantly increases the risk of aspiration pneumonia. Difficulty swallowing is a sign that your brain is losing control over basic functions that ensure its survival. An important warning is when you start to prefer softer foods or liquids, unconsciously adapting your diet. Sources close to Pope Francis have noted that he occasionally coughs when drinking water during meetings. This symptom is often mistaken for acid reflux problems, leading to ineffective treatments. If you notice that you need to concentrate more to swallow, or that it takes longer to complete meals, this deserves attention. 13. Erased memories. Lapses that herald brainstorm. The memory lapses that precede a stroke have alarming and specific characteristics. You may forget recent information, while old memories remain intact, or have trouble remembering names. These forgetfulness are different from those associated with normal aging or stress, as they arise and progress rapidly. Studies indicate that 47% of patients had significant memory changes in the previous weeks. The lapses occur because brain areas responsible for the formation and retrieval of memories are already suffering. When your brain is being deprived of oxygen, your memories begin to dissolve, like pages of a book being erased. A worrying sign is when you repeatedly forget conversations you just had or don't remember recent activity. Sources close to Pope Francis mentioned episodes in which he seemed not to recall details of recent meetings. These memory problems are often accompanied by difficulty concentrating and an inability to multitask. If you find yourself repeatedly asking questions that have already been answered, that's worrisome. 14. Revealing nights, sleep disturbances as an alarm signal. Sudden changes in sleep pattern can be an important warning sign of impending stroke. You may experience severe insomnia, excessive sleepiness during the day, or frequent micro-awakenings during the night. Studies show that 52% of patients had significant sleep disturbances in the previous weeks. These changes happen because areas of the brain responsible for controlling the sleep-wake cycle are extremely sensitive. What makes this sign particularly important is that it is often the first to appear, weeks before others. Your sleep is like a neurological barometer. When it changes drastically for no apparent reason, a storm may be brewing. Many people report vivid nightmares or feelings of suffocation during sleep in the weeks leading up to a stroke. Sources close to Pope Francis mentioned that he was facing restless nights and frequent nighttime awakenings. Another worrying sign is when you wake up more tired than when you went to sleep, even after 8 hours of sleep. If your sleep pattern has changed dramatically in a few weeks for no apparent reason, this deserves attention. Acting now is choosing your future. How to turn knowledge into protection. Recognizing the warning signs of a stroke is not just information, it is power over your destiny. Every minute counts when it comes to brain health, with doctors often quoting the phrase, "Time is brain." Studies prove that people who identify early signs and seek care have up to 80% fewer sequelae. The good news is that you now know the 14 most important signals your body sends before a stroke. This knowledge puts in your hands the power to completely change the course of your health and your history. Paying attention to your body's signals isn't paranoia. It's the highest level of self-care and self-love. The case of Pope Francis shows us that no one, regardless of their position or access to medical care, is immune. Remember that most strokes are preceded by mini-strokes or transient ischemic attacks that serve as warnings. Simple tests such as carotid ultrasound, brain MRI, and pressure monitoring can identify risks. Doctors claim that up to 90% of strokes could be prevented with early identification and appropriate intervention. Don't let fear or denial stop you from seeking help. Many people put off seeing them thinking it will pass. Modern medicine offers extraordinarily effective treatments when applied in the early stages. You trust your instinct to protect your family, your job, and your assets. Extend that trust to your body's signals as well. Imagine waking up every day with the certainty that you are doing everything in your power to ensure a long and healthy life. Think about the people who depend on you and what it would mean to them to have you present, lucid, and active for many years to come. Just as Pope Francis had the courage to seek help and follow medical recommendations, you too can make that choice today. The difference between a full recovery and permanent sequelae may simply be the time between recognizing a sign and seeking help. Your brain is the central command of your existence. Protecting it is protecting everything you are and everything you love.